What is the biggest challenge in hypertension management?
The biggest challenge in hypertension management per se is inertia of the patient.
And what can happen long term if BP remains uncontrolled?
An uncontrolled hypertension can lead to target organ damages.
Does one get addicted to BP medicines once it's started? It's a very common question.
I would say common but a stupid one. Do we call ourselves getting addicted to meals?
What is primary and secondary hypertension?
Primary hypertension is also called essential hypertension, which we don't find any cause for that. It is just like you get with age, or it just comes. There are no reasons which could be found out.
Doctor, when should one suspect secondary hypertension?
Dominantly, I think we discussed this. The most important indicator for me to suspect secondary hypertension is the age, too early onset, very late onset.
Doctor, is it okay to take generic medicines or one should stick to branded ones?
See, the idea of taking drugs is, it's not about, we are not wearing branded shirts or trousers or something like that. The idea is to control the blood pressure in a predictable manner 24/7. So anything which achieves this is good.
Hello and welcome to Heart Talks. Well, we bring you expert insights. In simple word, we help you to take charge of your heart health. I am your host Jenny, and today we are going to talk about something that affects millions of hearts silently. Hypertension, high blood pressure. Why it is called a silent killer? How to know your number? And most importantly, what can you do about it? To know all this, let's invite our expert, Dr. Arvind Sharma. Doctor, I have this first question, very important one. What is the biggest challenge in hypertension management?
The biggest challenge in hypertension management per se is inertia of the patient. It's difficult for somebody to accept that he is perfectly fine, asymptomatic, but somebody tells him that you are having hypertension. So the biggest inertia is from the patient side, uh, to accept that he is having hypertension, and another one is from the referring doctors. They also don't want to start treatment early, so that is the most important challenge. Second important challenge is, because this is an asymptomatic disease, the people are not willing to take any medicine for whatsoever. So as long as I don't have the problem, why should I take a medicine for lifetime? These are the two major problems which we face when treating hypertension among the people.
Okay. And what is the reason people don't stick to BP medicines lifelong?
As I said, it is because it is asymptomatic majority of time. So if I don't have any symptom, Indian perspective or even worldwide, it is like, if I don't have a problem, why should I take a pill for lifetime? Uh, Second thing is the compliance of the people. I may start medicines on to somebody, but they usually don't continue on the drugs for long period of time. So starting the medicine and continuing it, these two are the important things.
Okay. And what can happen long term if BP remains uncontrolled?
So an uncontrolled hypertension can lead to target organ damages. The usual victims are brain. People can come with brain stroke, that is what we called as paralysis. They can come with kidney failures, so elevated creatinine and everything. Ophthalmic damages like loss of vision or difficulty in, in vision. Then heart can get involved. So these are the four major target organ which are damaged: heart, kidney, brain, and your eyes. So these four can be damaged over the long term.
And this is also a very major question of all of us, that what are the symptoms of hypertension?
Majority of time it is incidentally detected, like you go for something else to your doctor. I go with simple complaint of fever, my doctors measures the BP. and tell me that your pressures are 170, 180, even though I don't have any symptoms. That is the most common presentation as far as hypertension is concerned. The other thing are the other symptoms, if we talk about the usual symptoms, are headache, blurring of vision. The headache is typically on the back side, that is called occipital headache, or some complication like stroke, kidney failure, and then we diagnose that somebody is having hypertension.
There are some more questions. Curious to know more about hypertension. What tests are usually done for hypertension?
Usually for we tend to do test when somebody is what we called as suspected secondary hypertension, like somebody who is very young or some very elderly gentleman starts with hypertension. We do tests to diagnose if we are missing out on some treatable cause of hypertension. So we do blood tests like kidney test, creatinine, electrolytes, urine. That is the most important and commonest investigation which should be done. We can do tests to document the progression of the disease, like echo, just to see whether the heart has become thicker or not. You can assess the fundoscopy, that is the visual thing. So the tests are dominantly done A, to find out if there is an associated secondary cause, and B, to document complications of the medicines which we are giving, and C, to detect the progression of the disease, whether there is any end organ involvement is there or not. So these are the basic tests which we would.
Does one get addicted to BP medicines once it started? It's a very common question.
Yeah, I mean, but it's a question which is, I don't know, it's I would say common but a stupid one. Do we call ourselves getting addicted to meals? No. So drugs are there, whatever antihypertensive we give are there to control the blood pressure. They don't make you addicted. It is requirement, it is not addiction. So every time, after lunch you need food for dinner or breakfast next day morning. Similar way, these medicines are there to control. They are not addictive ones. They are the one which are needed. They are the one which are required. So this question of whether I'll be addicted to drugs or something like that is, I don't know. What should we call it? It is not a question which should be there also per se. It's required. It's not. There is no addiction involved. We don't give any opioid analgesics or something which can make you, you crave for the disease. Addiction is basically you crave for the thing. Here it is not addiction. It is requirement.
Yes, you absolutely changed the thought behind it actually. What are the common causes of hypertension?
The commonest one is what we call as essential hypertension, which is a process which does not have any reasons per se. So essential hypertension is like it comes with an age, or a familial hypertension, like my family gets it in the early 30s or 40s, so I am getting it. So that is does not require any further intensive investigation, I would say. Not investigation but intensive investigation. But somebody who gets it either at a very young age, let's say in 20s, 30s or early 40s, or somebody who gets it at very late age, like say 80s or 70s, or somebody who was well controlled suddenly becomes uncontrolled on drugs, we need to look out for the reasons. That is called as secondary hypertension. The reasons are kidney disease, thyroid disorders. Then we have something called as pheochromocytoma, where the adrenal gland which releases epinephrine, that there is an surge in that. Thyroid disorders can lead to hypertension. So these are, and there is a congenital disorder which is called as coarctation of aorta, where the artery which takes blood from heart and supplies the major artery, Mahadhamni, what we call in Hindi, or aorta in medical science, that is narrowed. Then there is a disease of young females dominantly, that is called as aortoarteritis, where the main branches of aorta are diseased at the origin. So these are the common causes. Then there are other, like taking steroids, females who are taking oral contraceptive pills or hormonal medications, they are more likely to develop hypertension. So these are the causes of secondary hypertension dominantly.
What is primary and secondary hypertension?
Primary hypertension is also called essential hypertension, which we don't find any cause for that. It is just like you get with age, or it just comes. There are no reasons which could be find out. Secondary hypertension is one which is caused by certain other disorder in the body, as we discussed in the previous question. It could be kidney disease like kidney failure, or in young age we called as glomerulonephritis, which is like protein losing from the kidney, which leads to kidney problems. Then something called as pheochromocytoma, which is a tumor in the adrenal gland. Then we can have thyroid disorders, which can lead to hypertension. Then chronic steroid use, which is so rampantly common, can lead to this. Then drugs like oral contraceptives or hormonal replacement therapies, which are used for excessive menstrual bleeding control, they can lead to. There are certain other drugs which can lead to hypertension. So these are called secondary hypertension.
Okay, we get an idea about this. Doctor, when should one suspect secondary hypertension?
Dominantly, I think we discussed this. The most important indicator for me to suspect secondary hypertension is the age, too early onset, very late onset. Then, as I told, if we have associated reasons, like somebody is having known kidney disease or is diagnosed with some kidney disease, then we should suspect hypertension, secondary hypertension. Then if we are diagnosed with VO and other conditions, so that is where we should suspect unusual symptoms, unusual blood pressure controls. Somebody who develops kidney failure after starting certain medications, we know the kidney artery on both sides might be diseased. So I forgot in the initial half, kidney failure, kidney disease also include uh, disease of the kidney blood vessels which are supplied to the kidneys, that is called renal artery stenosis. So these are the clinical and some investigational parameters which make me suspect about the
Secondary hypertension. All right. Doctor, is it okay to take generic medicines or one should stick to branded ones?
See, the idea of taking drugs is, it's not about, we are not wearing branded shirts or trousers or something like that. The idea is to control the blood pressure in a predictable manner 24/7. So anything which achieves this is good. So this is a very difficult question to answer per se, honestly. But anything which can control my blood pressure predictably is something I would go for, whether that is so-called inverted comma generic or branded. It really doesn't matter. The thing should control, and that is most important.
Okay, thank you. That was really useful.